Bacterial infective endocarditis, one of is very highly tested, and one of the things you will be tested on is the indication for prophylaxis in these patients. And it can be a little tricky because it's there's specific cardiac condition that we consider high risk, and these are the patient who will require prophylaxis. Only patient with these high risk cardiac condition, and only patients who are undergoing certain procedures. So these procedures, we're going to talk about what these procedures are, and we're going to talk about what these high risk cardiac conditions are. Okay, so let's start with the high risk cardiac conditions. So there are about at least 4 high risk cardiac conditions, meaning that these patients are at high risk of infective endocarditis or recurrence of bacterial infective endocarditis. So these patients should receive antibiotic prophylaxis, right? And these are patients who have a prosthetic heart valve, okay? Patients who have a history of infective endocarditis, patients who have a transplanted heart, but that heart has a structural valve abnormality. So the patient is a recipient of a transplanted heart, and that heart has a structural valve abnormality. And the last one is patient with certain types of congenital heart disease. So these includes patients specifically who have a unrepaired cyanotic congenital heart disease, patients who have a repaired congenital heart disease but there is residual defect, and patients who have a repaired congenital heart disease but with prosthetic material in the preceding 6 months. Okay, so quite a mouthful there to remember. Let's just go back over them. Okay, what are the high risk cardiac condition for which patients will require prophylaxis against bacterial infective endocarditis? Okay, so we said patients who have prosthetic heart valve, patients who have a history of previous infective endocarditis, patients who have a transplanted heart and that heart has a structural valve abnormality, and patients who have certain subtype of congenital heart disease. And we said that these types of congenital heart disease are patients who have unrepaired cyanotic congenital heart disease, patients who have a repaired congenital heart disease but with a residual defect, patients who have a repaired congenital heart disease but with a prosthetic material in the preceding 6 months. So those are your high risk cardiac condition that requires prophylaxis. Sometimes you may have a patient with aortic stenosis, or you may have a patient with mitral regurgitation, or you may have a patient with a VSD or ASD. These are not high risk cardiac condition. Okay, only the one that I specifically mentioned are what we consider high risk cardiac condition that requires prophylaxis. Now, the patient must be undergoing a high risk procedure. Okay, so you may have a high risk cardiac condition, but you will not require prophylaxis if you're not undergoing a high risk procedure. So you must have a high risk cardiac condition and it must be a high risk procedure. So now brings us to the question, what is a high risk procedure? So there are 4 procedures that we consider high risk. Okay, gingival manipulation or respiratory tract incision. So When we say gingival manipulation, we're talking about tooth extraction, routine cleaning of the gums, any dental procedure. Okay? Respiratory tract incision would include, for example, the bronchoscopy where you would take sample or biopsy. All right? So those are high risk: gingival manipulation or respiratory tract incision. And then you have a GI or GU tract procedure in the setting of active infection. So, for example, you're talking here maybe about a colonoscopy or a cystoscopy, but it has to be in the setting of active infection, right? And then we also have surgery on uninfected skin or muscle. Okay, and the last one is surgical replacement of prostatic cardiac material. Surgical replacement of prostatic cardiac material. Okay, so those are your procedures that we consider high risk. Let's review them again. We mentioned gingival manipulation or respiratory tract infection. It doesn't matter whether or not the patient has an infection of the gingiva or the respiratory tract, you would cover them with antibiotics. Okay? We mentioned GU or GI tract procedure, but it has to be in the setting of active infection. So if you have a patient who have a high risk cardiac condition, let's say this patient has a prostatic heart valve, and this patient is undergoing a cystoscopy, but there's no active infection, then that patient does not require antibiotic prophylaxis. It has to be a GI or GU procedure in the setting of active infection. Okay, we mentioned surgery on infected skin or muscle. Again, I'm stressing the word infected because it has to be in the presence of an active infection, right? For a procedure or surgery on infected skin or muscle. And then we also mentioned surgical replacement of prostatic cardiac material. Okay, now comes the question, well, what antibiotic are we using? You're not always using the same antibiotic. The antibiotic of choice will depend on the most common organism affecting that location. So, for example, for patients undergoing gingival manipulation or respiratory tract incision, the most common organism that we need to cover for is Strep viridans. Strep viridans. So these patients should receive amoxicillin. Okay, amoxicillin. For patient undergoing GU or GI tract infection in the presence of an for patient undergoing GU or GI tract procedure in the presence of an active infection, the most common organism is your enterococcus. So these patients should receive ampicillin. Ampicillin. Okay? For patients undergoing surgery on infected skin or muscle, the most common organism is Staphylococcus. So these patients should receive vancomycin. You need to cover for MRSA. For a patient undergoing surgical replacement of a prosthetic cardiac material, you need to cover for Staphylococcus again, so you will give them vancomycin. Okay, so let's just do a quick recap of the procedure and the antibiotic coverage. All right, we mentioned gingival manipulation or respiratory tract infection. We will cover with amoxicillin because the most common organism is Streptococcus. For GI or GU tract procedure, the most common organism is Enterococcus, so we will cover with ampicillin. For surgery on infected skin or muscle or replacement or placement of a prosthetic cardiac material, the most common organism is Staphylococcus, so we will cover with vancomycin.